This lecture is about the endocrine system. We will first have a look at the main endocrine glands and major hormones. We will then focus on common endocrine diseases by way of short definition exercise before we review some of the questions a doctor should ask a patient when he suspects an endocrine condition. First, let's have a look at the human endocrine system. The body contains two kinds of glands, exocrine and endocrine. Exocrine glands secrete their products into ducts and include sudoriferous, sebaceous, mucous, and digestive glands. Endocrine glands secrete their products into the extracellular space around the secretory cells and include the pituitary, thyroid, parathyroid, adrenal, and pineal glands. In addition, several organs contain cells that secrete hormones but are not endocrine glands exclusively. Let's name the hypothalamus, the thymus, the pancreas, ovaries, testes, kidneys, stomach, liver, small intestine, skin, heart, and placenta. Now let's focus on hormones before we go back in more details to endocrine glands. There are four main classes of hormones. Steroids, like aldosterone, calcitriol, biogenic amines like T3 and T4, epinephrine or adrenaline and norepinephrine or noradrenaline, peptides and proteins like all hypothalamic releasing and inhibiting hormones, eicosanoids such as prostaglandins and leukotrienes. The response to a hormone depends on both the hormone and the target cell. Let's have a look now at the endocrine glands. We'll start with the pituitary. The pituitary gland is a pea-shaped structure. It lies in the sella turcica of the sphenoid bone. It has two separate portions, the anterior pituitary or adenohypophysis, which accounts for about 75% of total weight of the gland, and the posterior pituitary or neurohypophysis. 5 types of anterior pituitary cells secrete 7 major hormones. Although the posterior pituitary gland does not synthesize hormones, it does store and release 2 hormones, oxytocin or OT and antidiuretic hormone or ADH, also called vasopressin. For many years, the pituitary gland or hypophysis was called the master endocrine gland because it secretes several hormones that control other endocrine glands. We now know it has a master. This master is the hypothalamus. The hypothalamus is located below the thalamus, just above the brainstem. It synthesizes and secretes certain neurohormones, often called hypothalamic releasing hormones, and these in turn stimulate or inhibit the secretion of pituitary hormones. The hypothalamus controls body temperature, hunger, thirst, fatigue, sleep, and circadian cycles. The butterfly-shaped thyroid gland is located just inferior to the larynx. It is the only endocrine gland that stores its secretory products, T3 and T4. T3 and T4 regulate oxygen use and basal metabolic rate, cellular metabolism, and growth and development. Attached to the posterior surface of the lateral lobes of the thyroid gland are small, round masses of tissue called the parathyroid glands. Their cells are the major source of parathyroid hormone or PTH or parrot hormone. PTH increases the number of activity of osteoclasts, which are bone-destroying cells. Structurally and functionally, the adrenal glands are differentiated into two regions, the cortex and the medulla. The adrenal cortex is subdivided into three zones that secrete different hormones. The adrenal medulla consists of chromaffin cells that are sympathetic postganglionic cells specialized to secrete epinephrine and norepinephrine. The pineal gland is attached to the roof of the third ventricle. One hormone secreted by the pineal gland is melatonin, a biogenic amine. The pancreas is both an endocrine and an exocrine gland. 99% of the cells are arranged in clusters called acinni. These cells produce digestive enzymes. Scattered among exocrine acini are 1 to 2 million tiny groups of endocrine tissue called pancreatic islets or islets of Langerhans. Each pancreatic islet includes 4 types of hormone-secreting cells. Alpha cells secrete glucagon. Beta cells secrete insulin. Delta cells somatostatin, and F cells pancreatic polypeptide. The female gonads called ovaries produce estrogens and progesterone. They also produce inhibin, a protein that inhibits the secretion of FSH, and relaxin during pregnancy. The male has 2 oval gonads called testes that produce testosterone, the primary androgen. The thymus produces, among others, thymic factor, which retards the aging process. Now, let's review other tissues that also have an endocrine function. The heart produces atrial natriuretic peptide. The gastrointestinal tract organs produce gastrin and secretin and others. The placenta produces estrogen, progesterone, and others. The kidneys produce erythropoietin and renin. The skin produces cholecalciferol. The adipose tissue produces leptin and resistin. Now we're going to talk about endocrine symptoms and diseases. An absence of ADH would result in diabetes insipidus. A hypersecretion of GH leads to before and after puberty, to gigantism and acromegaly. Hyposecretion of GH before puberty would bring on dwarfism. A deficiency in TH in newborns would cause cretinism. The symptoms of a hypersecretion of TH are sweating, weight loss, palpitations, and a goiter. A hypersecretion of PTH usually causes fractures, fatigue, anorexia, constipation, and mental disorders. Hypersecretion of androgens lead to acne and abdominal hirsutism. The consequences of a hypersecretion of epinephrine are hypertension, sweating, and anxiety. A severe lack of vitamin D would lead to rickets, also called rhinitis, and osteomalacia. An excess of vitamin D would cause nausea, dehydration, calcium deposits in the kidneys. Now, let's review the questions you should ask a patient when you suspect an endocrine dysfunction. If you want to inquire about the weight, your question is going to be, have you lost weight recently or have you gained weight recently? If you want to inquire about your patient's appetite, your question is going to be, what's your appetite like? Sleeping habits. Do you sleep well at night? Sweating. Do you sweat more than usual? Fatigue. Do you feel more tired than usual? Thirst. Do you drink a lot of water? Urinary system. How are your waterworks for a British patient? How's your plumbing for an American patient? Bowel habits. How are your bowels? Are your bowels okay? What about your motions? Periods. Are your periods regular? Do you bleed a lot? Libido. What about your sex drive? Pain. Are you in pain? Alopecia. Do you lose your hair? Hirsutism. Have you noticed any hairs? Growth, edema. Have you noticed any swelling? Arrhythmia. Do you have any palpitations? Nervousness, anxiety. Do you feel restless, anxious? Now, let's review the main diagnostic tools and treatment options. Blood and urine tests to check the hormone levels. Hypofunction disorders are usually treated by replacement of the peripheral endocrine hormone, regardless of whether the defect is primary or secondary. Radiation therapy, surgery, and drugs that suppress hormone production are used to treat hyperfunction disorders. Thank you for your attention.